at the managed isolation hotel, the Novotel in Ellerslie. That includes staff, passengers on the flight, others who were at that facility or had been at it since the 7th of June, and other immediate contacts. 90% of them have already been contacted, and just 27 are still in the process of being contacted. All those in the hotel still were tested over the last day and a half, and those test results are coming through mostly today. So I just want to reiterate the comments I made this morning in my interviews that, clearly the ministry team and the staff, many people from across the public sector who have been working at the facilities in Auckland have been doing so for months and very, very committed to ensuring that we keep New Zealand's border safe. There was a lapse in the process for us introducing the routine day 3 and day 12 testing over the latter part of last week. And I know that the case of these two women will have upset people and shaken people's confidence. I've certainly been upset by it, and I apologise that we've ended up in this position. As I said this morning, and I want to reiterate, I've taken responsibility to make sure that the system is sorted, and we're getting on and doing that. And what I can assure people is that since I found out about it on Tuesday, as I've said, I've instructed that no one's to leave any of the managed isolation facilities unless they've had a negative test, whatever the reason. And that day 3 and day 12 testing is gearing up and in full swing. And yesterday, around 600 tests were done across the hotels as part of that. That's in addition to the testing done of the contacts there. So then just to finish off with our confirmed numbers, obviously have increased by 1, so our confirmed case number is now 1,157. We will report the additional case through to the World Health Organisation, and our total number of confirmed and probable cases is 1,507. I'm pleased to say there are no additional deaths to report, and the two women who are cases here and the person in Auckland do not require hospital level care and are being cared for where they are. Today, another significant cluster, which was associated with an aged residential care facility in Hamilton, has closed, and there are just 3 clusters that remain open until we've had that full 28-day period since the last person finished their isolation period. Yesterday, our labs processed 4,936 tests, and the total tests completed to date is now 321,187. Open to questions.
Why didn't the Public Health Unit tell you when they first learnt that the women had tested positive? Why didn't they tell you that?
Yes, so as part of follow-up, the Public Health Units routinely do follow-up interviews, in fact have quite a lot of contacts, because especially in a situation where someone's distressed, these women had recently lost a parent, and of course there's a lot of scrutiny on these cases. The follow-up interview on Tuesday evening, they volunteered the information that about getting out of Auckland they'd got lost. Neither of them recalled, nor still recall, the fact that there was brief physical contact with one of those two people. And so when the Public Health Unit did their assessment on the Tuesday evening of that information, they didn't even feel that these people were really, they may be casual contacts. The information wasn't passed on. As soon as I found out about it, which was yesterday afternoon, I rang and spoke with the Medical Officer of Health, and I asked her to have a follow-up conversation just to verify all the details, and that's what they did, and that's when I released that update last evening.
Why do you treat what they said as fact? Because all of your statements said they hadn't had any contacts with anybody. That was just based on what they've said, and it was erroneous, as it turns out. But why were you treating that as fact rather than this is what they've said? Because it's a trust-based system.
Yes, so a couple of comments there. And the first comment here is, of course, it's really important for contact tracing and effectively managing any risk to the community that we get full information. And as I've said, and the Medical Officer of Health involved here is one of our most experienced ones in the country, this is very common, and this is why they do the follow-up interviews, because it does elicit additional information that people may not have recalled or they may not have thought was important. I provided all the information I had on Tuesday when I made the announcement. As soon as it became clear what the other information was, and I was privy to that. I released that in a further statement last evening.
How can you trust anything that you say?
Well, I hope that people will trust what I say, because we've spent the last few months, right from my very first stand-up, being open about and communicating with the public about what was happening. And every day, everyone got the same information at the same time about the cases. And of course, in this situation, yes, the information has evolved. I haven't kept that to myself. I have shared it.
Director Jen, you stated as fact what these women were telling you, it was wrong. So why should we trust anything that you say?
Because on Tuesday, that was the full extent of the information I had, and the action that was being taken was based on that information. Now that we have further information, I have both shared that and also asked that that information was acted on.
Have you gone back and questioned all of the things that the women said and made sure that they're checked to make sure that they haven't forgotten anything else?
I haven't personally, but the Public Health Unit does that, again, as a matter of course. A number of conversations and exchanges of information happens through the day yesterday. And also, of course, the Public Health Unit talked to the people in Auckland to verify and just cross-check that information, and that will be ongoing. It's very important, and it's also important that people feel confident and able to share that information and don't feel they're going to be criticised, or that, it's very important that people feel confident in the system and that it's going to support them. So I do want to make that point as well.
It doesn't seem very plausible, like the women got lost and ended up at a friend's place. Can you just explain to us
Yes.
why you're obviously buying the story?
So what I'm doing is sharing the information I have, because that's the information we are using on which to base the actions we are taking. Actually, they took the wrong motorway entrance and ended up, and for those of you who haven't lived in Auckland, it can be done. They ended up travelling north instead of south, and I think partly due to the stressful circumstances they were in. When they were able to get off the motorway, they rang the friends who had dropped the car off, and the car had been dropped off in a contactless way, with the keys given to a security guard, and arranged to meet them to help them get back on the motorway in the right place. At that point, there was a brief exchange conversation, and as we've described, a short physical contact, which was actually an arm around one, possibly both of the women from the side, and this is information we've verified with all those involved. And I just want to reiterate, the two women here, who are the ones who have lost a parent, don't actually have any recollection of that element of the exchange, which is why we have verified that in Auckland. So what I am doing, and will continue to do, is to share the information I have, and if additional information becomes available, I will share that too.
Shouldn't the public have confidence that your officials are asking the right questions, that they should have been able to inform you that, yes, these women did stop, or did the women lie?
What I can say is that the first interview is done, and it's about an hour, and in this case it was, and I actually was on a teleconference after that first interview, remembering this was Tuesday morning, we wanted to get as much information as we could. They gave me all the information, actually listened to it all so that I could share that. An experienced public health physician or medical officer of health and public health nurse did that, but that's why they go out. That was their initial interview, and what they're really trying to do is get the picture. It was in subsequent discussions that there was the information elicited that, yes, there had been this brief contact. The women originally hadn't volunteered that. They have now, and we have acted on the basis of it.
It became public. Is that good enough? I mean, shouldn't they have volunteered that beforehand? It's really important that they did stop, that you know exactly where they were and what they did.
Yes, it is very important, and that's why there are the follow-up interviews, because as Dr. Nesdale, the medical officer of health, said to me, it's very common in these interviews, particularly where people are under stress or there's grief involved, that information, they think of other things that may not have been top of mind, or they may have just not considered material or important. And that's why the follow-up interviews are undertaken, so that we can make sure we're managing any potential risk.
Of the 200 people that were granted compassionate leave, do you know how many of those were tested, or how many have been followed up and tested subsequently?
Yes, so I'll tell you what I know, because I just got an update from my team before I came. So I've asked that everybody granted an exemption, a compassion exemption, since the 7th of June, which is when the two women arrived into the country, that all those are followed up, and to check whether they have been tested. Now, I should say that when these exemptions are granted, the person gets a letter with a very strict series of expectations and protocols that need to be followed. I can't remember the number off the top of my head, but what I can say is that our information to date is all those people since the 7th of June to the 14th of June have been tested, and we're just matching that with it. We would have heard if there were any positive tests. We're just matching that with our database to make sure that that's true.
Prior to the 7th of June, we can't say that people had to have a test before they were allowed to leave on compassionate grounds.
It wasn't a requirement, but it would have been done in many instances, or they would have been required to get a test during the subsequent period. It depends. So some of those compassionate exemptions, in fact the majority at the moment, are just for, or even up till the level 1, alert level 1 changes were just for leave to go out for a short period and then back into the facility, rather than, so the minority of people are getting leave to go and stay with family and then complete the rest of the isolation period outside of the facility. Most go and then come back.
Bloomfield,
We've been made aware of a flight which took people who are considered close contacts of the women from the Novotel Ellerslie to Christchurch well before their isolation period was finished and without being tested. Were you aware of this flight?
Yes, I'm aware of the flight. That was one where, because at the moment our facilities in Auckland are very full. Through most of alert level 3 and 4 they weren't. There are now 15 facilities, and in Auckland they're very full. There are a lot of people coming in, so an additional facility has been stood up in Christchurch. And this is also so that people who are intending to go to the South Island when they finish their isolation can have the opportunity for a compassionate exemption. So yes, there was a flight down there. Anyone who was on that flight from Brisbane with those women is part of that group of close contacts. They've all been followed up, including those that are in Christchurch.
But we've been told that there were people from all different hotels across Auckland taken down to Christchurch. So put on the same bus, the same plane, the same bus again to the hotel in Christchurch. People had not received negative tests or tests at all, which was supposed to be a requirement. How did that happen?
So the all-of-government team operates the logistics of moving people, remembering that once those people were down there, they were in a managed isolation facility, and as I said on Tuesday, nobody leaves a facility now unless they have returned a negative test for whatever reason, and so they are under the same protocol down there. So those people in the facility down there will be under exactly the same expectation.
That requirement came in on the 9th, and that flight happened on the 15th. So well after that requirement came in. And why wasn't the public made aware of the fact that this flight happened?
Well, I can't speak to why the public wasn't made aware, but I can say yes, that people were moved down there to ensure that we could help manage capacity in Auckland and use the facility in Christchurch, and so that people who lived in the South Island who previously have not actually been able to access a compassionate exemption because there was no way to get them down there. So the all-of-government team, and you heard yesterday that Air Commodore Digby Webb, who has been leading that, has confirmed he's got the all-of-government lead there, organises the logistics of getting people down there into a very carefully managed isolation facility.
Much of an isolation though, is it, if people are being moved on day 5 of their isolation and they're mixing with people from all different hotels who have come into the country at all different times? That just doesn't really make sense.
So there are obviously protocols in place to make sure that the risk is managed for that flight down, but again, Air Commodore Webb will be able to talk about the logistics of how those flights are undertaken. And again, just going back, I can reiterate, no one leaves a facility unless they have returned a negative test now, whether it's for a compassionate exemption. Of course, those have been suspended for now, or at the end of their 14-day quarantine period. There was a question here.
Dr. Bloomfield, David Skegg told Mike Hosking he fears there could be clusters of people with COVID that we don't know about emerging in New Zealand. How concerned are you about that?
Well, I'm not concerned about community clusters because we've had a long period without detecting any COVID-19 infections on shore. The 2 cases that we confirmed on Tuesday and the one today have clearly come in across the border. I can't think of any explanation of why we would have cases undetected out in the community when we haven't actually found any for many weeks now. So I'm not quite sure on what the basis is for Professor Skegg's claim here.
Details on how one of the women was able to go through isolation and not report that she had symptoms? You said you were going to look into that.
Yes, when I spoke on Tuesday, I mentioned that she did have some mild symptoms that she ascribed to a pre-existing condition. It was some sort of shortness of breath and tightness in the chest. That's still the case. And in fact, she didn't put any stock on those symptoms, so she didn't report those symptoms or think of them as material. It's now clear that they were, and so I think this is something that's important for us to, to keep in mind, and our staff in the facility. And I have actually looked at the exit health interview done with her, which is very explicit around symptoms. And again, I think she must have just not ascribed anything material to the mild symptoms she had at that time.
Do you have a sense?
Yes, indeed. Yeah.
Dr. Bloomfield, do you know how many people in quarantine haven't been tested as per the directive on during the night?
I don't, but I'm finding that information out.
You should probably know that though, right?
Yeah, and that's why I'm finding that out. I don't at this point.
Why not? Why hasn't there been a running tally making sure that the directives and the protocols put in place by you haven't been followed?
And that's exactly why I've said I've asked my team to review and go back and look, not just at the protocols that were in place, and it's just why the testing wasn't rolled out as I expected at that time and consistently. It was taking some time to stand it up. So, and as part of that, I've asked them to review and go back and just look at how many people may have left during that period without having the test. Can I just make one other comment here? Recall that the testing was introduced as a belt and braces to the mainstay of the border management, which is 14 days isolation, which we have had in place for several months. There was no routine testing of people. We undertook to roll that out as part of our routine, just as an extra precaution. It was taking longer to roll out than I expected, and that is what we're fixing now.
Argue you should have been doing that all along. On the two women, given how distressed they were, should you have given them leave to drive from Auckland to Wellington? And also, do you recognise that because of your botch up, they are now facing the fury of the country, and do you apologise to them?
So what I want to say is that over the last few months, our team working on exemptions, including compassionate exemptions, has dealt with hundreds of applications. Many of these have been profiled in the media. There have been some very tragic ones recently, particularly sudden or accidental deaths of people. Every application is looked at based on a set of criteria that are available and through a process, and indeed I've been taken to court because of one case where we wouldn't let someone out on compassionate leave. We had to amend and update our process. So every application is looked at and assessed rigorously and fairly to look at whether any potential risk can be mitigated. In this case, it was felt that the risk could be mitigated by having a very strict and clear plan in place, and that is the case for each compassion exemption. It's a requirement of the court that we do that thoroughly for each individual compassionate exemption.
Women have been vilified though because of the mistake.
Well, I think the vilification is unfortunate. I don't think that's because it should be happening, and I don't think it's because they were granted leave on under a compassionate exemption, and I think many people will understand the impact that the loss of a parent, remembering they were here hoping to see their dying parent. The person died overnight, and so our team worked as quickly as possible to make sure that there was a safe protocol in place, but looked at it as they are required to do so.
On that flight, is your figure of close contacts going to be extended to include the people that were on that flight from all the different hotels and are now in that hotel in Christchurch?
Yes, correct. So you'll recall early on in our response to the pandemic, we considered only people within 2 seats in either direction of someone on a flight as a close contact, and the rest as casuals. We are following every person up on the flight, every person who is either resident or working in the hotel, and or every person who has been in the hotel that may now have left as if they were close contacts. We're calling them casual plus contacts because we want to make sure they are all tested, just as part of a very precautionary approach there.
Are you expecting that number to grow?
This is for the flight for the 2 women from
No, the flight, the transfer flight that took people from Auckland to Christchurch.
Oh, so all those people in the facility in Christchurch will be being tested as part of the protocol that's in place.
So they're considered close contacts too? And
no, they are not considered close contacts, but they will be tested anyway as part of the managed isolation protocol.
On Monday, I think you're aware of this case, someone who was given an exemption was just about to walk into a Christchurch hospital ward, only they informed the hospital. Why was this person allowed out of quarantine early? Were they tested, and how long had they been in the country? And why were they allowed access to a hospital?
So can I talk just generally about, I don't know the exact specifics of that case, but one of the exemptions under compassionate grounds is to go and visit a dying relative. Sometimes those relatives are in a hospital ward or in a hospice rather than at home. And there is a plan and agreement put in place that requires the agreement of the hospital ward and the person and ourselves, or the hospice. And unless that agreement is documented, then the person is not allowed the compassionate exemption. As part of that process, they have to specifically notify the ward or the hospice when they are coming to do the visit, and there are very strict requirements about distancing, use of PPE and so on for those visits. So that's part of the protocol for that type of managed type of compassionate exemption.
Can I get an update from you on the Rotorua school situation? What's the latest on that? I understand that the flight attendant tested negative.
Yes, I heard that actually in the media. So as part of the follow-up for the two women, the contact tracing, yes, all 5 crew from the flight from Brisbane to Auckland were followed up and tested. And I've heard reports, yes, of one based in Rotorua who has tested negative. And so that, I think, puts to rest that there's any potential contact or infection of that person.
What about the story that has been raised by Michael Woodhouse about the homeless man staying in one of the quarantine facilities for 2 weeks? Have you had a look into that?
I haven't had a look into that, but now that I know about it, of course I will.
Is the Ministry considering
Sorry,
more
just
stringent
up the back,
requirements for international flight crews though?
We've looked at those. So 2 things I will say here. First of all, we looked at them over the last few weeks, and particularly for Air New Zealand crew flying the long-haul international routes, and there are stricter requirements now for any flying to the USA and doing a layover and coming back. So they're required to self-isolate at home and return a negative test before they're then allowed to go into the community. The other 2 long-haul additional routes have very strict protocols at the other end, including aircrew staying, in one case staying airside and not even going landside. The second comment I would make is off the back of what I've learnt about the flights from Australia to New Zealand, such as the one that the 2 cases came on, and indeed the case today who actually wore a mask throughout the flight. I asked my team yesterday to look at the option of requiring all passengers to wear masks on those flights, because it seems that people are coming from a whole lot of international flights and transiting through and then coming on, and just as an additional precaution, the advice from our infection prevention and control team was to make masks available. I felt it was important to require masks for the duration of that flight, so we're putting that in place as well.
The testing of these close contacts of Tuesday's cases, do these close contacts, are they required or mandated to take a test, or is it voluntary?
So the close contacts, the true close contacts, are actually just the father who is the parent here whom they're with in the Greater Wellington region. The others, all other contacts, are required to be tested. Indeed, the aircrew, the staff, the health staff who were involved in the hotel over that period, and of course those staying in the facility are required to be tested. Day 3 and day 12, we're just making sure they're all tested.
Press release from yesterday said that should be encouraged to get a test, not required. Why that sort of discrepancy?
This may be people who have left the hotel after their 14 days isolation. So if they have had a test prior to discharge, to leaving the facility, then that would be fine. So we're following them all up. Each one will be assessed depending on the circumstances.
So there's no legal authority issue with requiring people within facilities to be tested?
Yeah, not within facilities, no. And this has been traversed, and in fact there was a very nice description of that on the radio just an hour or so ago by Professor Geddes from Otako. Under the current order that's in my name as the National Medical Officer of Health, they can be required to be tested, so we've made that really clear.
We've spoken to multiple
Sorry,
people.
question up the back.
Could you
please just talk through what the military will be doing and what they can do that the Ministry of Health can't do?
I can't talk through that because that's the responsibility of Air Commodore Webb. And if there are specific questions, you can contact the all of government communications team or send them through us, and we will put those to him. However, what I can say is that ever since the facilities have been set up, the oversight of the management of the facilities has been an all-of-government responsibility anyway. The announcement yesterday was affirming the role that Air Commodore Webb has and the ability to draw on additional defence resources as required to ensure that those facilities have got the staff they need and are able to be run in accordance with the very strict protocols that we, from a public health perspective, require them to be run.
People were allowed to leave.
So for people who arrive from overseas, will they see anything different at all, say tomorrow, versus what they might have seen 2 days ago before yesterday's announcement that, you know, the Defence Force was stepping in? That was kind of the tone.
Just to comment here, over 19,000 people have gone through managed isolation or quarantine facilities since they were established. We've identified under 40 cases there, and we saw, prior to these 3 cases announced this week, we had effectively been able to eliminate community transmission of Covid-19 in New Zealand, in part because of the rigorous process at the border. I think what we are wanting to do is make sure that our border is, as I've described it, both airtight and watertight, and the additional resources that the military can bring to that will just, again, help with ensuring that the processes and protocols are all followed.
What are those resources? I mean,
I think Air Commodore Webb is the best person to answer that.
You're managing the whole thing, so...
No, again, I just need to reiterate that actually the overall management of the facilities has from the start been an all-of-government. So there's an all-of-government team, and they've been responsible. Our responsibility was to provide the public health advice and the protocols about how the facilities should be managed, and we're responsible for ensuring that the health aspects of what happens in those facilities is done appropriately.
Is Mike Bush still the head of the all-of-government team? And also, could these cases force us to move back a level?
So Mike Bush is still the head of the operations part of the all-of-government team. John Ombler is the overall all-of-government lead. And no, these cases are expected cases at the border. We will see more. You may have heard this morning that Victoria, I think, reported 18 cases yesterday. 11 of those were from border-related cases. So remembering that actually the number of cases worldwide continues to grow, and also we've got New Zealanders still wanting to return from all parts of the globe, and so we expect to see more cases at the border.
18 people were allowed to attend a funeral in Christchurch on
Yes.
Tuesday. Should that have happened considering compassionate leave for funerals was cancelled 10 days ago?
In fact, the application for that in that particular instance had been processed well before the change to Alert Level 1, and there was very strict protocol on. There were 2 groups there. One were at the end of their isolation period and were all tested negative before they were allowed out. They were just shy of the end of their isolation period. The other 9 were transferred to Christchurch, very strict protocols, and they watched the funeral remotely, and then were escorted in 2 small groups very carefully out to, from a distance, observe the burial, then back in the managed isolation facility. So I've looked through all the detail of that. I wanted to be sure that the risk was managed appropriately.
364 close contacts of the 2 women have been tested.
They're not close contacts. So we're just taking a really precautionary approach here. Everybody in the hotel, all I think but a small number of the staff so far, all of the health staff who looked after them, all the airline crew, and all but 27 of the people who were at the facility and during that period and have left have been contacted, and a conversation happened.
About tested, how many of them, the 364 have been tested?
Well, the vast majority have been tested, including all those still at the hotel, and the staff, and we all the others are just about all contacted, and we'll be able to update on the testing status of those ones.
News Hub has just been told by a GP that a patient staying at the Novotel said that the testing is voluntary. So why is it voluntary and not a requirement?
Yeah, so this is what I clarified on Tuesday when I sent a directive out to all of the hotels, the managed isolation facilities. There had been some question about whether the order in place could compel people to be tested. I checked with my chief legal advisor and got a very clear direction, and that's in fact been confirmed by a professor of law today, that under that order, yes, because they have to be low risk before they can leave the facility, and I will only deem them to be low risk if they are tested. So that's one of the things that's been clarified, and that's why no one now leaves the facility unless they have had a negative test and it is a requirement.
Auditor General's report into PPE management sort of showed that there were mixed messaging, there was no stock take taken, much of the PPE had expired. So what's your response to that report?
So my response is, yes, there were some really clear lessons about some of the preparation that could have been a lot better as part of the pandemic planning. But the important thing about what the Auditor General's report highlighted was that New Zealand had maintained good stocks and supplies of PPE during the outbreak we were managing, and that once it became clear that the distributed sort of way that PPE was being given to staff, so out through DHBs, the procurement of it wasn't working, the ministry pulled that into a central procurement process and distribution process, and sorted out the distribution out to all the different providers, including aged residential care, pharmacy, primary care and so on, and that we did that well. And there are some good recommendations for how we might continue to improve that as part of our ongoing preparation.
How quickly would you implement those recommendations? The Health and Disability Commissioner has asked that they be implemented as quickly as possible because that sector wasn't included in the modelling for the demand. How quickly could those recommendations be put in place?
So my team's looking at them right now to map out in fact I spoke with the person who's doing that this morning. We're mapping out our response to each of those recommendations. Much of that work is already underway. So it will be, because we were able to have a look at an early draft of the report, so we had an early idea. This is part of the process of just us providing, assuring on factual accuracy, and so we were already thinking about where those recommendations might be going.
And it's also sort of showed that behind the scenes there was a lot going on, with sort of that the stock had expired, there wasn't as much you thought, and that sort of thing. Yet sort of the public-facing messaging was that there's nothing wrong, be safe, feel safe. And there was, and it highlighted the mixed messages. Do you think you were as transparent as you could have been during that time?
So wherever there was an issue identified, I acknowledge that, where we had expired stock, where we had, where some providers were not receiving the PPE they needed, where there was a gap between what the infection prevention control advice was and what some workers felt they needed in particular situations. My comments were designed to acknowledge and address those, and that's why we worked hard. At no point in time did we not have available stock and then put in place a process to get that out to people who need it as quickly as we could. So yes, there were some problems with expired stock. I acknowledge that every time, but that did not put our overall stock and supply in jeopardy.
By failing to disclose critical information, that they had symptoms, that they met with a friend, did these women break any laws?
No, they didn't break any laws, and again, I just want to reiterate that case interview is really important, and that there was always follow-up on a number of occasions just to ensure that if there is additional information, that it's elicited, because the key point here is we want people to feel safe about giving information so we can manage any potential risk. Sorry, a couple more questions, please. Yep. It's all right, we'll go to someone else, but I will come back to you.
Does that just highlight...
Sorry, which situation?
Sorry, with the Rotorua situation,
Oh, yes.
does that just highlight how one person can bring a city, not to its needs, that's being a bit dramatic, but 4 schools were affected by that?
Yes, I think there were 4 kura kaupapa, or yes, that were affected. It does, and it's just really important that even when we do get people coming in on flights who we find at the border, there will be precautions on the flights, but we are really taking this very precautionary approach to making sure everybody is tested, and we will get other instances of cases at the border, and we will do the follow-up, and we will track and trace, and we will ask crew to be tested. This is just part of our follow-up to make sure we're reducing any risk to the community.
Is it acceptable that Healthline relies only on the phone numbers that people give them on their arrival cards when to contact them? They could be fake numbers, and they might not be numbers. Is that acceptable? Or are there any other ways of contacting these people? And is there a public list of all the hotels that people are quarantined in?
On the latter, I'm pretty sure there's a list publicly, and I can confirm that, but I'm pretty sure that's on the All of Government website. You'll recall now everyone's going into quarantine, and there's a lot of detailed information collected on them, including, and they're all Kiwis or family members. Many of them will have or will be allocated a National Health Index number. The National Health Index has updated contact information for people as well. So yes, early on we were relying on contact information that people provided on arrival cards. That's no longer the case, recalling that people are all actually being looked after for 2 weeks in one of these facilities.
It's come back to me, thanks. So, have you ordered isolation hotels to tighten up their social distancing measures? Should we expect to see the end of things like birthday gatherings in hotel lobbies?
So it's not my job to order. I've outlined what the expectations are. The All of Government team is responsible for the sort of enforcement on the ground and ensuring that's what happens. So again, that is one for Air Commodore Digby Webb. But what I can say, and I think you heard Mike Bush, to whom Air Commodore Webb reports, talk about this yesterday, that actually there would be a renewed focus on ensuring that the expectations around gathering and around physical distancing are maintained across all the facilities.
So the people in the hotels enforcing the rules aren't your people?
No, they're not our people. They're from a whole range of different organisations, mostly government, across government, but also and military and police and so on, but also some private sector security and so on.
Ahead of moving to level 1, you'd said you were hopeful that the government would require businesses to print out official government QR codes. Does sort of Tuesday's cases underscore the reason why you wanted to have that contact tracing ability more widely available?
They do underscore a lot of things. We're not out of the woods yet on this. There is a large global pandemic underway. Secondly, we will see further cases. We are absolutely committed to ensuring that the border is watertight so that we keep New Zealanders safe. But third, the more than we can prepare across all aspects of our core public health elements, if we do get further cases in the community in the future, the better. And the more work we put in, that's why we're continuing to upscale our contact tracing capability and capacity, sort out PPE, maintain our very good laboratory capacity, and ensure we've got good supply of reagents. Our health systems are ready to go if they need to, but also we need people to continue to download the app and use it, and I just encourage them and businesses to put the QR codes up.
To continue to advocate within government for that to be a requirement for businesses?
Well, at the moment, we're expecting, and more businesses are doing that, and I think that's good to see that every day there are more businesses doing that. Let's see if in a few weeks' time it might be that we would add a requirement in. I know that the ministers will be open to advice on that if we think it's useful. Final question?
Just in relation to the Hamilton Tangi, after the two fleeing, returning to isolation, one is still allowed to isolate in Hamilton and one not a hotel in Auckland. What measures are in place to prevent them leaving again? A fake address appears to have been used the first time. Who checks those addresses for the exemptions, and what has been done?
Yeah, so at the moment there are no exemptions. So, but in this case, yes, two people did abscond. Not all 6 that went to the funeral. 4 went back. There was a huge effort that went in with police, the iwi and our health staff, and they were found very quickly actually. And there was quite a lot of negotiation and discussion, and I think a good outcome. One went back to the Auckland facility, and one had agreed to be in conjunction with a Māori health provider there to be isolated in the community, strict protocols, and was tested as well. And both of them have been tested and tested negative. So I think it was a good outcome again. there are challenges in running these managed quarantine and isolation facilities. It's a complex business. At any one point in time, there are several thousand people in there, and the staff there do a fantastic job to help ensure that the people there are well looked after and that also New Zealanders are safe. And where there are these issues that arise, the system gears up really quickly to make sure that the risk to New Zealanders is mitigated. Thank you very much.